City of Austin sets a new coronavirus response trigger. Austin Public Health says to keep gymnasiums, bars, and salons open, we need to avoid an average of 20 COVID-19 hospitalizations per day. Going forward, the number of people admitted to the hospital will play a key role in determining if the economy can open up even more or if it needs to be scaled back. Right now, Austin is in stage 3 of this city-developed risk assessment with about 8 to 10 hospitalizations on average. KXAN's Eugene Cho spoke with Austin's mayor today about this and if and when the city could close businesses again.
They've got masks on.
Whenever we go out, we do wear face coverings.
And stay 6 feet from others.
One of the reasons we come here is because we can sit outside and the tables seem to be far enough apart.
The governor's order allowed these businesses to once again welcome diners and shoppers.
The task in front of us is, if we want to reopen the economy, if we want to reopen life, if we want to increase physical interactions, then we have to do everything that's within our power and control to make that successful.
For Austin city officials, that success is keeping the hospital patient numbers low. But they have a plan if it does go up. In stage 3 of this risk guideline, workplaces open include essential businesses and those reopened places. If more people start to get sick and the city moves to stage 4, that workplace open column doesn't include reopened businesses anymore. We asked the mayor if that means the city would try to close those businesses again, independent of the state's orders.
If we're facing our hospitals being overrun and overwhelmed, and people dying needlessly because they're not getting the care that they need, then we're going to act. I would expect us to act at all levels, at the state level, at the county level, and at the city level.
Dr. Mark Escott says if hospitalizations increase to over 20 a day, the extra precautions recommended in stage 4 will prevent overwhelming the hospitals. Eugene Cho, KXAN News.
Health officials said while this varies from person to person, on average, COVID-19 patients in Austin and Travis County spend about 11 days in the hospital.